Hello and welcome. Today, we're diving deep into a rare but potentially life-threatening heart condition called Catecholaminergic polymorphic ventricular tachycardia, or CPVT. We'll explore what it is, what causes it, and how it's managed. This video is for informational purposes and should not substitute professional medical advice. CPVT is primarily caused by genetic mutations affecting proteins that regulate calcium handling within heart muscle cells. The most common culprits are mutations in the RYR2 gene, responsible for the ryanodane receptor 2, and the SESQ gene, which encodes calsequestrin 2. Less commonly, mutations in other genes involved in calcium regulation can also contribute. These genetic changes disrupt the normal flow of calcium, making the heart susceptible to dangerous arrhythmias during periods of stress or exercise. The underlying mechanism of CPVT centers around abnormal calcium release from the sarcoplasmic reticulum, the heart cell's internal calcium store. Normally, calcium release is tightly controlled, triggering proper heart muscle contraction. However, in CPVT, stress or exercise can trigger spontaneous, uncontrolled calcium release. This uncontrolled release leads to delayed after depolarizations, or DODs, which are abnormal electrical impulses that can initiate ventricular tachycardia, a rapid and irregular heartbeat originating in the ventricles. The polymorphic nature refers to the changing shape of the QRS complexes on an ECG during these episodes. CPVT is a rare condition, affecting an estimated 1 in 10,000 people. Because it's genetically based, it can affect individuals of all ethnic backgrounds. The condition often manifests in childhood or adolescence, but can sometimes present later in life. It's important to note that many cases may go undiagnosed, especially in individuals who are asymptomatic or have infrequent episodes. The hallmark symptom of CPVT is fainting or near fainting, known as syncope, triggered by exercise, emotional stress, or excitement. These episodes are caused by the rapid and irregular heartbeats that impair the heart's ability to pump blood effectively to the brain. Some individuals may experience palpitations, chest discomfort, or dizziness prior to a syncopal event. In severe cases, CPVT can lead to cardiac arrest and sudden death if left untreated. Diagnosing CPVT can be challenging. A standard ECG may appear normal between episodes. The diagnostic gold standard is an exercise stress test, where the individual is monitored on an ECG while exercising. In individuals with CP, the exercise test can provoke ventricular tachycardia, often displaying the characteristic polymorphic pattern. Genetic testing can also confirm the diagnosis by identifying mutations in the RYR2 CSQ2 or other related genes. In some cases, an epinephrine stress test may be performed if an exercise test is contraindicated or inconclusive. While there aren't strict classifications or types of CPVT beyond its genetic etiology, RYR2 CPVT, its CPVT, the severity and frequency of symptoms can vary significantly between individuals. Some people may have only occasional episodes, while others may experience frequent and life-threatening arrhythmias. This variability highlights the importance of personalized management strategies. The primary goal of CPV treatment is to prevent life-threatening arrhythmias. Beta blockers, which slow the heart rate and reduce the impact of adrenaline, are the first-line therapy. Flecainide, a sodium channel blocker, may be added to beta blockers in patients who continue to have symptoms. In some cases, an implantable cardioverter defibrillator, or ICD, may be necessary. An ICD is a device that monitors the heart rhythm and delivers an electrical shock to restore normal rhythm if a dangerous arrhythmia occurs. Lifestyle modifications, such as avoiding competitive sports and strenuous activities, are also crucial. Since CPVT is a genetic condition, primary prevention focuses on early diagnosis and management. Genetic screening of family members of affected individuals is essential to identify and treat those who may be at risk. Avoiding triggers such as strenuous exercise and emotional stress can also help prevent episodes. Patient education and adherence to prescribed medications are crucial for successful prevention. The prognosis for individuals with CPVT depends on several factors, including the severity of the condition, adherence to treatment, and the presence of an ICD. With proper management, many individuals with CPVT can lead relatively normal lives. However, untreated CPV carries a high risk of sudden cardiac death. Recent research is focused on developing more targeted therapies that address the underlying calcium handling abnormalities. Gene therapy is also being explored as a potential future treatment option. Ongoing research continues to improve our understanding of CPVT and refine treatment strategies, offering hope for better outcomes for those affected. Thank you for watching.